another episode of
the Bari Chronicles.
Damo, this week we have a friend of the Bari Chronicles that we're going to be chatting with.
So excited.
Yeah, we're talking with Associate Professor Michael Hii. And Prof Michael is from Melbourne Weight Loss Solutions. We are very, very excited and thankful to have you with us today.
Thanks for joining us. Hey everyone, so we are here with the amazing Professor and Dr. Michael Hii. Michael, thank you so much for joining us.
Thanks again, guys. Thanks for inviting me back, and it's a real pleasure as always. I've been loving your work on the socials, watching some of those posts, so happy to contribute.
Thank you. Yeah, it's such a great space to be in now, I think, with so many more people willing to talk about bariatric surgery, weight loss surgery, whatever you want to call it, but people are more willing to talk, and I think that is such an important part in spreading knowledge.
Yeah, totally. And we were just talking about medications, weren't we, Damo? And it's really opened the kind of conversation to a lot more people.
Yeah.
And hopefully the combination of medicines and surgeries and lifestyle and just knowledge, as you say, will make this a much safer space for people going forward.
Yeah.
Yep. That is 100% what we want to see. Just people choosing whichever route it is that's going to be the best for them so that they can do all of the awesome things that they want to do with their life and not feel like they've got to just sit back and miss out.
100%.
Yeah. So while we're sort of talking on that, I thought it might be fun to talk about some of the myths that are around bariatric metabolic surgery, and some of the things that we've heard over the years. They are out there, but Tash and I were like, yep, Dr. Hii is the man to answer.
Yes. So the first one of my personal favorites, weight loss surgery is the easy way out.
Yep. Classic.
Yeah,
we see people posting about this all the time, don't they?
Yeah, we do. I mean, I literally nearly every day on TikTok, I have to rein myself in, reel myself back in when I see people saying, "Oh, that's the easy way out."
Do you
Well, it's so interesting though, isn't it? To me, that sort of says two things, right? So first of all, they've never seen someone go through it.
Yeah. Exactly.
And the second thing it says to me is it's really it's a very, very thinly veiled backhanded insult, isn't it?
Mm.
Like the only reason to say that is to sort of put someone down a bit.
Yeah.
Like why would you? It doesn't really even. You're not helpful.
Yeah.
Anyway, I mean, you guys will know this much better than me that the surgery is not easy. It's not fun. No one asks to have it again.
Yeah. Yeah, exactly right.
But it's supposed to be effective, right?
Yeah.
Or give your best chance at being effective. So we try and emphasize that right at the start. We want to make it clear what it might look like for people. And that's why, pages like your Facebook page, I think we're on the Instagram at the moment, but I think your Facebook page with so many real life lived experiences and people happy to share is so important.
Mm. Yeah.
For an operation that has to last for someone's life, yeah.
Yeah, that's right.
Yeah, because it's not like it's just, we have surgery this year, we lose all our weight, and then we can just forget about it for the rest of our life.
Yeah, we can just do whatever we like then because we've had a surgery. It doesn't work like that, does it?
No, I mean, it's I don't know, do you guys, we refer to it as a reset. Do you guys call it that?
Yeah.
So obviously going through life, you learn a lot of things about how your body works and in particular what your body responds to and what it doesn't. And obviously there's little variations for everyone. And that we know that after surgery, if you get that reset and even if you do lose a lot of weight, if you do the same journey exactly the same again, look, it's very likely the weight will come back, yeah.
So what are some of the biggest adjustments that you think we need to make in order to have it be as effective as it can be in the longer term? I know that it's going to vary, but just generally speaking.
Well, my number one message is I'm really big on the whole foods, clean foods
Yep.
way of doing it. And I think you're right. Everyone is different, and there's also different ways to get success. So I think that's why you see so many different options on the socials and in the
Yeah.
support groups, because there is actually lots of ways to do this. You don't need to do everyone the same.
Mm.
So for me, and in our team, we really love to emphasize the clean eating. So
Yep.
home foods, whole foods, prepared foods, and minimal processed foods. And obviously incorporating as much strength building exercise as possible. For me, they're the two big physical pillars, not talking about the psychological stuff. They're the two big physical pillars. That's the advice we give. Do you guys feel that's sort of a practical option for many people, or do you think that's sort of asking a lot, and particularly refreshing the eating? What do you think?
I guess something that I tend to worry about occasionally is when I see a post that goes up about I want to eat the exact same way, just smaller portions.
Yeah.
And for me, because when I relate that to myself, that would mean, okay, so do I go to Macca's 3 times today and just have cheeseburgers? You know, like I had to make some real hard, drastic changes that I didn't drive into a drive-through takeaway every time I drove past one.
Yeah.
And that was the reality for me. So, yeah.
I don't know. I think that emphasizing the lifestyle and movement, getting out there, doing whatever it is that you like doing, is awesome. But I think when it comes to moderation, I had no idea what it was at all. I didn't know. Like my team would say, "Oh, eat in moderation."
What does that mean?
Okay, what's that exactly? Like
Moderation was the end of the meal, like the end of the packet of biscuits.
My food.
I finished the bag of chips. That was my moderation.
So sometimes I think that can be a little bit of a stumbling block. Like that's just my personal opinion. I feel like
I've seen you guys posting, and I've seen your meal prep and stuff. So how did you get from there to here?
From there to where I am now, I actually spent a lot of time in the first, it was probably about month 6 where I realized I have no idea what I'm doing. I don't know what moderation is. I don't know how to do that. I don't know what it looks like or what a moderate amount of anything is. How will I learn what that is? Yeah. So I actually got online and I started to, I knew basically what my stomach capacity was in terms of cup size.
Yep.
So I started working out how many macros were in the different foods that I commonly ate. So how much of that would be in half a cup of food, or how much of that would be in a cup of food. And I know this wouldn't work for everybody, and I get that, and I understand that we don't want to focus on numbers, but I didn't know what to focus on at all. I had no idea. I was so clueless and at sea, and I asked for for help, and my dietitian was awesome, but they would just say, oh, well, just eat it in moderation. But again, I didn't know what that was. I had no idea. So I was very scared and frightened, and having an understanding of what a serve was really helped me. So that's what I focused on, is understanding how much a serve is of a particular whatever it was. And then I kind of worked my way back from there. I don't know if that makes sense, but that's what has worked for me, is understanding what I'm eating. And now I've got this little framework around myself, and I know basically what I need to have good blood tests and to have enough protein each day. And I just kind of make my meals up around that.
Well, I'm glad you brought this question up. That's really interesting. And obviously you guys are really motivated to be in this scene. So I'm not judging anyone, but you guys are going to have a lot more information about this space than most clients. So it's interesting, isn't it? When we say things as clinicians, we often just assume that those nods and those smiles, signs of, yeah, I know what you're talking about, but sometimes there's a big gap,
It's
isn't
not.
there?
It's not. I was so embarrassed. I was really embarrassed. Like I would sit there at the dietitian and she'd say, you know, a serve. Like just have a serve.
It's just, this stuff is so important for us to get out there, isn't it?
Yeah, like okay, what's the serve? Like how much is that? And I think a lot of times that's where fear can really come in, and fear of food itself, because nobody, as you said, nobody wants to have you know another operation or have another bariatric procedure or something. We don't go into this hoping that will happen.
Yeah.
But when you go into it and you don't understand what you need to be eating or how to nourish yourself well, then there is fear that can come in, and then people get into, well, I believe that I was going down a path that was potentially very harmful for me, and perhaps, you know, down the route of disordered eating. And that's why I started just going, well, I've asked the dietitian, they're just saying to eat moderately. I don't know what to do. I actually did end up enrolling in university because I was like, okay, well, I really, really want to know what to do. Someone help me, please. So yeah, that's the.
Well, I really like the meal prep videos, and I know that they're probably a huge amount of work for people to create. I know you've done some, Tash, but I really love them, and I love how real they are and how raw, but also that now what you've just said to me also helps me understand. That also gives people an appreciation of what is a serve, what is a portion size, where is the target.
Yeah, that's right.
One of the hard things that I faced, and I actually remember my first takeaway meal after I had surgery, and it was about 2.5 years. Our daughter was in hospital having treatment, and you know, Kim was staying with her. She was going to be in for about a week, and I hadn't eaten anything literally in 2 days, and I was, you know, just feeling terrible. And Kim said to me, "You need to get something to eat." So I remember driving through Hungry Jack's, and I'm looking at this board going, you know, what do I have? Yeah, I honestly thought that by having anything, I was going to just slip back into it and, you know, I'd be done. And so I ordered, you know, sort of the smallest burger, and that was all I ordered. And I drove away going, wow, I can actually go to this place and order, you know, probably a third of what I used to eat. And I didn't even finish that. And I was just like, okay, so, you know, maybe I can be a little bit normal, whatever that means. I don't have to restrict myself.
Well, that's important to point out as well, isn't it? Like, it's not this, the surgery's not, we started with this with surgery's not the easy way out, but it's also not, you know, you're not going to be locked basically in a prison cell eating exactly the same thing all the time as well. You can be normal, and you can slip up, and you can have a burger. You're not going to die.
Yeah, that's right.
Magically just come back.
That's our next question that we're wanting to ask you, or, you know, myth number 2. You'll never eat normally again. We all have those friends that, or family members that'll say, oh, you don't want to do that surgery, you'll never eat again.
Yeah.
Well, again, I certainly haven't found that to be true. I think I love food more now. I think I love that I know how to give myself what I need and also what I love, and I can do it, and I know that it's not going to mean that everything falls apart.
Yeah. Yeah, it's so, for us, we're trying to judge it all the time where someone's headspace is at, and we're trying to get that balance right between not freaking out about, you know, surgery and its magnitude, but also not being so relaxed that there's nothing as well. It's really an important thing to try and find that happy middle ground, right?
Yeah.
I mean, you guys are sort of a long way down from surgery now. But when you go out socializing with your friends and stuff, like I would imagine that there are some situations where, like if you're at a barbecue or something, eating while you're talking and standing up, but often people could just assume, you're just not that hungry today or something, right?
Yeah, it's not. I don't get as scared anymore. I used to think, if I go out and I don't have anything, then people are going to be asking me questions and I don't want to have to answer. And it really wasn't like that. I discovered that most people really don't give a stuff what you're eating. And I was like, oh, wow, and now it's like, because my wife Kim, she's had gastric sleeve as well. So there are times where we'll go out and just like, okay, what's something that we can share this time? Or there are times where we go out and I'll be like, no, I really want something else. And I'll either leave what I don't eat or I'll ask them to package it up. It just depends on what it is and how long before we're going to get home. But I don't feel guilty anymore about leaving food on my plate.
I guess, the myth you'll never eat normally again. I guess our perception of normal actually also needs to be addressed. Like what we think is a normal serve in 2025 would not have been a normal amount of food for most of human existence, right?
Yeah.
Like, if you get a large meal at just any standard restaurant, the amount of food would be like a meal for a king 100 years ago.
Yeah.
So eating normally, that's got to be taken in context as well, doesn't it?
We have a local.
It's very interesting. That's a very interesting thought. It really is. Like
the whole normal.
Yeah.
What is?
Well, we've got a local pub, and I was looking at their. Just had an ad come up for them, and Wednesday nights is their steak night, and for $50 you can get a 1.2 kilo steak. Yeah, and I'm looking at that going, my goodness. But the scary thing is, once I would have done that,
you'd never get that through that, would you? 1.2.
Yeah.
Would you?
Yeah.
Whoa, that's a lot of meat.
And there are a lot of people that do it. Now that would do my whole family with leftovers. And I just
so your normal is just your normal, right? Like
it is. I think like back to when you asked about like what would happen at a barbecue. When I go out with my friends, my standard order is 3 oysters. Like that's my standard order, because I also have celiac, so there's always that added little oh my goodness, will it be gluten free? But yet no one. The only time that there's ever a comment is it's usually wait staff, and is everything okay? Can we get you anything else? Is everything okay? And it's purely from the point of view of have we pleased you? Like, is everything all right? It's never, oh my goodness, blah, blah. So that's been a very interesting change, I guess, for me. And my version of normal is go out with my friends, enjoy a really lovely meal, have a drink if I want to have one, but only one. Otherwise, I will be very silly because gastric bypass, and it hits differently. But yeah, I think in terms of socializing and family events and functions and out with my friends, it's really, for me, I enjoy being with the people now more than the food. I used to go out for the food. Now I go out for the people.
Some of the extended family can be a bit painful if we're eating around them. And you do get the comments of,
I nenever am, so it doesn't worry me.
It used to, I guess, early on, because I guess I didn't know what to do because I didn't have any supports around me. So I just decided, okay, I'm never going to eat a dessert again. I'm never, and if it's not, if I get a plate of food, then protein first, and if I'm not full from that, then I'll have some vegetables. And I think everyone was so sort of freaked out at how I'd changed that I was always getting here, you need to have this piece of cake, or, and eventually they stopped, because I'd just be like, no, I'm not doing that. And I'd get up and leave if it continued. So,
Can I ask though, like in the past, if you were on a diet, right, and you said to people, I'm on a diet, would people say, hey, eat more? Or is it just because you've had surgery?
Just because I'd had surgery.
Yeah.
Because
it's funny, isn't it?
Isn't
we'd be on a diet and everyone would be, oh, don't.
I'm perpetually on a diet. I was perpetually on it my whole life. Like
yeah. And then suddenly you've had surgery and everyone's trying to feed you because, you'll fade away to nothing.
It's so weird, isn't it?
It is. It's very, very odd. It is very strange.
And it's these things that can really make someone's journey difficult, because it's not just themselves that they're having these internal arguments with and having to deal with. It's other people, and even worse if it's family, and then you get close family that do it as well, and it can really mess you up.
In terms of another myth that kind of links into that, one that's really, really common, and something that's been said to me, something that I'm sure is said to a lot of people, is, oh my goodness, why would you do that? Weight loss surgery is so dangerous.
Yep.
What are your thoughts around that?
Well, we've got to be careful when we talk about this one, because obviously surgery always has risks, and
Yeah, it does.
we know in the big nationwide database that probably one person every few years might even die from complication from surgery.
Mm-hmm.
But also we know statistically that, for example, when you have appendicitis and you go to hospital and have an appendectomy, that most people have heard of that operation, often the chance, depending on how sick you are, but the chance of having a major surgical problem with an appendix can be as high as 1 in 52%.
Wow.
When you have your gallbladder surgery, also a lot of weight loss surgery people have heard about that, because that's a topic. But when you have that surgery, the chance of having a leak after your gallbladder surgery is 1 in 400. And as far as we can tell in the database in the country, the risk of a leak from a bariatric surgery is probably less than both of those.
Gosh.
So putting it in context, whilst obviously there's always a risk, it's one of the safest surgeries these days,
Yep.
Yeah.
And the amount of life gained and life years gained is unbelievable. So sure, I would never say it's not a serious undertaking, but I think take it in context. It's about as good as gastrointestinal surgery probably gets, really.
Yeah, that's right. I mean, what are I know what my risks were had I not had the surgery. Yeah. I was teetering on the cusp of type 2.
Yep.
Heart disease, as I've said before, heart disease gallops in our family. It doesn't run, it gallops. It's a thing. There's also quite a significant history of people developing different types of cancers that are related to overweight and obesity as well. So I knew I had all of that as well. All of that was stacked up on one side, and bariatric surgery was standing there on the other. So I took the blue pill.
Yeah. Well, that's exactly right. You got to choose your reality. You got to choose your normal. You got to choose.
That's
your
right.
reality.
100%.
Look, surgery is a big deal. Surgery should never be done lightly, but bariatric surgery is not as dangerous as perhaps people have remembered. And I think that comes from the gastric stapling days and the open surgery days, which probably has overly influenced how we think about modern metabolic surgery.
I mean, obviously, there's I don't think we've ever asked anybody, but what were the differences? Like the old, I don't know, in my mind, I have this kind of staple gun kind of thing in my mind when I think of stomach stapling.
Well, that was basically it, Tash.
Wow.
So
Okay.
there was a big cut up and down your tummy, or left to right, depending on the surgeon, and you'd have to put your hand inside and carefully identify the part of the stomach that was going to be stapled, and then it's just a glorified staple gun. I
Gosh.
mean, obviously it's a bit more than that, but if you distill it down to its essence, it's just firing a whole row of staples and a few stitches, and that's it. And
Wow.
look, back then in the 80s and 90s, it was, I guess, a reasonably good solution to a very difficult problem. And obviously, we all know back then, no one knew anything about obesity and why it was so hard to treat. It was a different fight.
Yeah, absolutely. I mean, we actually do have some wonderful members in BSA that have had stomach stapling or that have gone on to have other things after that initial procedure. And they've all said just how incredibly different it was, how different the recovery has been and all of those things. I can't even imagine. But I guess that just shows how desperate we are to need assistance, to deal with what is an actual disease and not just a lifestyle choice.
Absolutely.
Yeah.
So yeah, I think, taken in context, that was a good tool at that time. Just like gastric bands are probably okay at that time as well.
Yeah,
I mean,
100%.
you can only have the technology you have, right? Like, it's nice for us to look back now and say, look, we've got better instruments now.
Yeah.
But
I mean,
at the time,
hindsight's always 20/20.
Exactly, right? Like, we're not all getting around with a horse and cart anymore for a reason. And
Yeah, that's right. Exactly right.
for a reason, but they were good at the time.
Yeah. Yep.
Wow. Actually, there was something I was going to ask there.
Have you gotten?
Yeah, slippery as my mind is. Anyway, so I guess one of the next question that we've got, the next myth, and I actually said this myself when I had my surgery, was 20 kilos gone forever. I had this thing that, okay, I've had weight loss surgery and I'm never regaining this. Whatever I lose now, it's not coming back. And I found that to be a very disappointing reality.
I mean, that touches on what we were saying before, doesn't it, really?
It does, yeah.
And often people, when you're a surgeon, often people thank you, for their outcome. And I always say the same thing, look, our job is, my job in particular is basically one day in your life. And then to make sure you get out of hospital. It's not a big part of the whole journey, actually.
Yeah.
The people that are so happy and doing so well and sort of thanking you afterwards, I really try and emphasize to them how much actually they've done, which is the most of it. The surgery, it's a tool and it's a powerful tool, but it's really amplifying what you do in my way of describing it. Without any interaction from you guys, it'd be a pretty crappy tool, probably.
Yeah. I mean,
So,
I don't know, like I guess, like, actually just today I did a post in our Facebook group, and really it was just one of those little mindful moment just to think back and to be grateful. And I said, my bariatric surgeon is the bestest ever because, and so many people are commenting really wonderful things. And one of the things I think that sometimes you fantastic surgeons miss is the fact that because you're kind and because you see the overwhelming evidence behind what you do, you treat people that have lived with obesity with kindness and dignity. And that's why we're grateful.
okay. That's a really important distinction. Thanks.
Because when you've been treated so poorly in the past, when you've experienced what it is to be marginalized, and when you know how it feels to walk into those appointments and your weight is brought up as a reason for you being whatever. When you're finally sitting in front of somebody who is able to see past that and actually give you hope, you remain grateful for a lifetime. And
that makes sense, Tash.
yeah. So
that's true. Actually, the number of people that sort of break down and sort of are quite emotional or cry during an appointment, it's amazing.
Yeah, because I don't know, there is something about it that even though we understand that we have to do the doing, it's the fact that we were given the opportunity and enabled to be able to do that. And I think that it's just something that I'll never stop being thankful for. And I'll never stop being grateful for the fact that I've been able to make those choices and have a tool now that I can live a different life. Yeah.
Well, that's one of the most, I think, important things about what groups like yours does, and that is to break down that kind of, and I hope this is okay to say, but the prejudice, you know.
Yeah, there is prejudice.
That's disgusting, and it shouldn't happen. It happened in the past for many different reasons, and it sort of kind of happens a bit now on weight. And
yeah,
that's one of the most important things about BSA, to kind of try and dispel that prejudice.
Yeah.
Well done to you two guys, actually.
Well,
I mean, it's actually done a lot for Tash and I, even doing podcasts and meeting so many surgeons. And at the heart of it all is a caring for their patients.
And a desire to help, but an understanding. And this is one of the things that I hope people take away from this particular podcast, is that there are specialists in the world who don't look at those of us that have been doing life in a bigger body and just see that you're disgusting, that there's all of the different things that we've unfortunately, a lot of us have heard or have had said to us and things like that. And when you're in front of somebody that's actually wanting to help you, that's excited to help you, it's life-changing. And it's done my heart so much good to know and understand that there are people that actually understand and believe what we know, which is, it really wouldn't have mattered what I had tried. If I had not had bariatric surgery, I would still be in that bigger body, although it would be much bigger by now, because it didn't matter what I did. Without the surgery, I just wasn't able to achieve what I was wanting to.
Yep.
So,
yep. And well, you're a great living example of it, and it's great that you sort of try and help other people as part of your journey. You're really unselfish. It's really lovely.
yeah, it just becomes something that you're passionate about, and yeah, it just is.
Yeah, it's nice to sort of, I guess, flatten the road a little bit for other people, and you know, help them miss some of those potholes, I guess. You know,
Exactly.
that we hit on our journey, you know, and I think that's something that I love about this whole thing with, you know, weight loss surgery, even the medications and everything, is that it's constantly evolving and getting better. And I find that really exciting.
Yeah, and on that note, it's good, important to take all that in context and know that we're all on the same side. We're just trying to find the best way to do this.
Yeah. So we've got some other questions. Tash, you can ask the first one.
Oh, the first one is about sex. So we get asked a lot on BSA. I get messaged quite often, oh, Tash, I'm too embarrassed. I was so embarrassed to ask my surgeon, but when are you allowed to start having sex again? Or the other one is it okay to have oral sex? What if, like, what if I swallow fluids? Can they get into the staple line? Blah, blah. So take it away, Dr. Michael.
That's not that common a question, I guess, because they ask exactly. It's something that's really important to talk about, isn't it?
Yeah.
So obviously, sex varies in terms of its intensity and its physicality.
Yeah.
But essentially, I think it'd be safe to do as long as it wasn't exacerbating any symptoms, which is the same as all physical activity.
Yeah.
So if you're having sex and there's no pain, it's not exacerbating your wound pain, you're not doing any particular movement that's causing a pulling or a tearing sensation, then that's going to be fine. And I think for most people, as you know, most people when they go home, they have 1 or 2 pain tablets, but not a lot.
Yeah.
So for most people, I think by the end of the week, they could be having relatively gentle sex at that time, and that'd be totally safe. There'd be very little that could go wrong. If you really wanted to get into it, if you really wanted to get into some vigorous sex, then probably you'd have to wait the normal time we recommend for heavy lifting, which is a month.
Yep. Okay.
And I know most people are going back to the gym at a month.
Yep.
So, depending on your style, I think there's a range of times when you could very safely reintroduce sex.
So no chandelier swinging early on.
Wait till you're home from hospital.
Yeah.
Oh, you wait for that's a good one too. That believe it or not, that happens. That's
I've actually have a story.
We know it happens.
Yeah.
I didn't want to bring it up, but yeah, that happens. With respect to oral sex is fine, and again, when you're within the realms of I guess normal oral sex, it's pretty much nothing you can do that's going to damage a staple line.
Okay,
or cause any sort of surgical complication.
Yeah, awesome.
Having said that, we also do esophageal surgery as part of our field of practice in Australia, upper GI surgeons, and I do a presentation to the gastroenterologist every now and then about perforations. Perforations is when a hole is in an organ for some disease reason, and I've got a slide of this ginormous dildo that someone swallowed.
Oh my God!
Actually put a hole in their food pipe, tore their food pipe. So again, even with oral sex, there are sort of extremes where you can cause yourself a little bit of trouble, but normal stuff would be okay.
Oh my goodness!
That's it. Yeah.
See, everything in moderation.
Yeah.
Yes.
That's right, Damo.
Moderate people, not.
Yeah.
Wow. Goodness me.
Awesome.
Did you have to get that one out?
That one was I think it's I'm not sure how much I'm allowed to say, but there's a patient that came through our emergency department.
Yeah. Wow. Okay.
I won't say if they're male or female.
Yeah. They're okay though.
They're okay in the end.
Wow.
And, thankfully, didn't need aggressive surgery, but there certainly was a hole in the food pipe from swallowing something a little vigorously.
Did they get their toy back?
I don't know.
Yeah.
It's probably worth a lot of money. So.
I mean, wow.
But what do you think would be the most frustrating myth that you have patients believing?
That's a great question. I guess everyone's different. Everyone's got their own journey. So there are kind of a lot of different myths, like I can't drink alcohol again. I can't have spicy food again. I need to do X, Y. Like some people have really very focused ideas of what needs to happen, but there doesn't seem to be like a lot of common threads that we constantly find annoying. I guess in the olden days, I'm just talking about 10 years ago.
Yeah.
But I guess in the olden days, the calorie thing was still a big deal.
Yeah.
We sort of do a myth-busting thing on what a calorie is and where it's relevant, but how it's actually not that relevant most of the time.
Yeah.
I'm so
these days
the calorie thing's gone away. Well, to a large degree anyway.
Well, I think we have a much better idea of where it's useful.
Mhm.
Whereas it used to just be applied to the whole system, right? Like
Yeah.
everyone was told calories in, calories out, calories in, calories out. And that was basically the extent of the science. Now we sort of know, there's a big, big picture and that's just one little piece, yeah.
Calories.
I mean, for us, that's part of the joy of actually the follow-up and having the team approach,
Yeah.
Like our team love talking about that. And they sort of, they almost get excited when there's something to sort of break down and explore. It sort of takes it out of the day-to-day.
I love, because we've spoken to a few members of your team.
They're all lovely.
Yeah, they're great.
They have their passions about all different things, and I love that. It's just so great talking to them.
Well, we work really hard trying to build a good team, and I'll tell you, all these staff that we have, I'd be very, very happy to see myself as if I was a patient. They're really passionate, they're really kind, they really believe in their work and what they do, and they go out of their way to do a good job. It's an absolute joy to work with these people.
Yeah.
I feel privileged.
And where would you recommend people go if they're wanting to research their options and get some evidence-based support with what they're doing?
Well, look, funnily enough, I often ask them, I get them to join BSA on the Facebook.
Yep.
I often, so at the end of a consultation, I'll say to people, look, we're going to send you some information. So we always give them some information about whatever procedure they're sort of looking at and leaning towards. But I love to just suggest that, seeing someone's real, unadulterated, lived experience written by them in an uncensored way can also be really helpful. You see the good, the bad, the difficult bits. So I think BSA is a great one. And, again, because you guys sort of try and keep it platonic and sort of not trying to push people in a certain direction, it's very good, I think.
Yeah, that's right.
And then, of course, we try and put as much information on our website as possible. On our socials, we have different kind of angles. So I try and do a lot of stuff about the science of obesity and why it's hard to lose weight, why surgery works and all that sort of stuff. And then Julia, who is one of our dietitians, but she does a lot of our social work, she really does a lot of information about support, how to manage things in the post-surgical phase. So we try and provide a lot of, drip-fed information throughout our network. But I love recommending you guys, actually.
Okay, let's thank you so much for joining us today, Professor Michael.
Yeah, it's been awesome and great discussions.
Yes.
Well, thanks for having me, and I love talking to you guys. It's such a comfortable space.